I'm pleased to be joined by Representative Liz Cheney. Representative Cheney, how are you doing today?
I'm great, Will. Thank you for having me. Good to be with you.
Well, thank you for being here. Last week I was talking with the chairman of the Broadband Task Force, and he was telling me one of his main concerns was telehealth in this state. And now you've introduced some telehealth legislation. Can you talk to us about what the telehealth legislation is and how it will help the people of Wyoming?
Sure. Well, this is an issue that has really been important for some time. And what we saw during COVID was the Medicare was willing to change some of the rules, to provide some exceptions, to provide reimbursement for telehealth medical treatment. And because that's such an important issue for us in Wyoming, because people in too many cases have to travel long distances to see doctors, I began thinking about and looking at ways that we could make those exceptions permanent.
How important is it to have a strong telehealth system? God forbid there should be a disease like COVID-19 again, or if there were a natural disaster, as there are prone to be in this state.
When you have a situation like we had with COVID, where you worry about exposing people, you worry about contagion, this also helps. And you know, in too many cases, we saw, unfortunately, during COVID, people decide that they weren't going to go get treatment for other things that might be bothering them, other issues they might be having because of concern about being exposed. And so telehealth is a technology that we really do need to use.
It really isn't a partisan issue, getting health care to people in rural Wyoming who would have to drive hours to get to a hospital or their primary provider.
No, it's not partisan at all. And that's one of the reasons why I wanted to make sure that we had a bipartisan bill. Debbie Dingell is on the Energy and Commerce Committee. She's a Democrat. And I think that really helps to send the message that this isn't a partisan issue, but it's an issue that really matters to us.